Hello and welcome to the Medtronic Diabetes live stream here on the floor of the 78th Annual Scientific Sessions of the American Diabetes Association. We're live in Orlando, Florida, in this amazing conference where there's over 15,000 healthcare providers and people from companies representing the diabetes world. And the theme of the conference is Diabetes Breakthroughs Happen Here. So in our Facebook Live video, we're going to be interviewing individuals with perspectives on the world of diabetes, specifically from Medtronic. And my first guest, Laura Stoltenberg, welcome to the show.
Thanks so much, Rob.
Laura, you're Medtronic's General Manager of Multiple Daily Injection Solutions.
That's right.
And you're teeing up this conference for us. So tell us a little bit about why ADA is so exciting for those of us who, even like myself, weren't really sure what to expect.
Yes, it is quite an event. So my kids ask me, all right, Mom, why do you have to leave on a weekend? Where are you going? You're going to go to Disney World? No. Yeah, well, we are in Orlando. We're here. It's much, much more than that. So there's a couple really cool things that happen here. There's scientific sessions. So we've got some really smart scientists from around the world who are doing some cool research on diabetes. They're looking 5, 10, 15, sometimes 20 years ahead as far as where are they going to take kind of new therapies and devices. Companies like ours are here. Opportunity to talk to different physicians, people with diabetes about what we have available today. They can ask questions. And really the cool thing is, just like it says here, inspired by you, we have an opportunity at ADA to ourselves ask questions because we don't want to stand still. We always want to be looking at the next thing, innovating. And like you said, some of those statistics, literally everyone here is here because they have a passion around improving diabetes care.
And it's really inspiring, actually, to be around so many people involved in the world of diabetes because from a patient perspective like myself, we didn't choose diabetes, but all the people here did, and they're working for us and for us as the patients in that world. So you talked about the future.
Yeah.
It's really cool to see all of the different sessions, all of the different products, all the different presentations. What's so special about this year's ADA compared to years past?
I think I've been in the healthcare world and medical devices for a while now, and just about 4 years in diabetes. And even within the 4 years, I mean, it's really amazing to see a lot of transformation. I think just coming in first, it was a lot of drug companies and maybe some technology, but it kind of felt like, all right, we have this drug, you have to pick. Now it feels like everyone here is really focused more on what do you need as a person with diabetes. So rather than having you adjust to what we think you should do, now we're adjusting to you. So, one example is just around, we're just launching Guardian Connect, a first standalone CGM with Sugar.IQ. We heard from people, hey, we want more than just a number, but, oh, wait a second, I don't want too much data, it's going to be overload. So we really listened and took that to heart and are trying to refine the types of insights that we give as part of our CGM system.
And your MDIS team at Medtronic and with Guardian Connect, the first smart CGM system put out by Medtronic, you guys are looking at the holistic diabetes experience, and that's new territory for Medtronic. And talk a little bit about that. Tell us first,
right.
What is smart CGM? And talk about some of the work you and your team are doing at Medtronic to say, hey, we're not just pumps anymore. We're also pushing out into the holistic diabetes world.
And I think part of it is really being able to meet people where they are and what they need with their journey managing their diabetes, and with the realization that not everyone can go on pumps. We have a world-class pump system that Hiten's going to talk about in a little bit, but whether it's economics or access or, for a lot of different lifestyle reasons, there might be people who don't want to pump. So that's where, with my business, we're focused on it. And again, the concept around SMART is that we want to be able to try and make sense of all of this data. So one example with SMART is, hey, I want to know sometimes if I'm low, it's almost too late to actually do anything about it. So part of SMART is, hey, can we build smarts into the system to anticipate if you want to know, I'm going to get in a car for a while, I really want to know 60 minutes ahead of time if I might go low, because then I might pack some sugar or to help mitigate that, and it's something that I know that I'm going to keep track of, kind of like the weather forecasts.
Right, and for oftentimes as a person living with type 1, diabetes is often just adds an extra step to everything that you're going to do. So that predictive number, even for me on the 670 hybrid closed loop system, being able to have the suspend before low feature and being able to know what my blood sugars are going to be, super helpful and great for the lifestyle component. We also talked a little bit about at the conference, this is a diabetes as a whole. So it's not just type 1s like myself. There's also the type 2 component, which also comes into your MDIS team. Talk about working between both of the conditions and how you guys are addressing those.
Yes. So with type 1, it's obviously you're diagnosed, and then immediately you have to understand what it means to manage your diabetes with insulin, how to carb count. A lot of times type 2 being a more progressive disease, and you might be diagnosed later in your life, you don't have the benefit of all that training. And a lot of times we hear, hey, I'm just told eat right and exercise, and I have no idea what that means. So part of what we're doing is being able to provide people like that with type 2 additional insights. So it goes beyond carb counting. So I might not know how to carb count, but I know I just ate a peanut butter sandwich, and then be able to provide the smarts behind the scene to say, was that peanut butter sandwich, what did that do to your sugars? Did it go up? Did it go down? Was it the combination of that peanut butter maybe with something else that you had to drink? So again, it's really being able to meet the person where they are with diabetes. And we're taking a couple big steps forward. We're now providing these solutions for folks who we haven't been able to before, but we also know we have a long way to go.
I think we do, and it's incredible to see the steps forward and the big impact that they make, and just giving people living with diabetes more confidence to make those decisions. Let's talk a little bit about Sugar.IQ as a component of the Smart CGM system. How does Sugar.IQ deliver those insights to people to help make those decisions a little bit easier?
Well, we have a Sugar.IQ app, which is in partnership with IBM Watson, and it's available in the U.S. with Guardian Connect. So basically what it does is it takes that information that someone might log, and again, it's really simple logging. It's not carb counting. It's just a drop-down menu. This is what I ate, logs when I ate it. And then in the background, it's kind of matching that with CGM data. So as soon as you log something, you might get an insight immediately as far as this is how your sugars responded to that particular food. But as you log more artificial intelligence, then in the background it's getting smarter and smarter and more personal. So it's not just the food that you log, but maybe the time of day that you logged it. So as an example, we have some people now, it's really exciting, we're starting to get this information back. Having coffee on the weekend when you have no stress, even though coffee is a stimulant, was actually fine. And the user said, I now know I'm good, but gosh, I looked at with Sugar.IQ what that exact same cup of coffee did during the week when I'm at work and I have that stress, and oh my gosh, now I see I might have to dose 2 or 3 more units of insulin. So I think hopefully maybe that's, and the fun part is we're starting to get a lot more of these really personal stories back.
I think that's what's really exciting for me, and I was discussing it with some other people living with diabetes here at the conference, is getting those insights delivered to us through a system that's reliable. So it's not just going on your gut. You actually have the data easily accessible and, like you said, easy to log, because there's also been a lot of talk about data overload, and I think every person with diabetes who's ever tracked their sugars manually throughout the day will identify with that. And so it's great to see how easy companies like Medtronic are making it to log those numbers and those different meals throughout the day. In the realm of inspired by you, any kind of final thoughts for people living with diabetes that you and your team are thinking about and pushing forward? I think for me, it's always inspiring to hear how in tune people like you, Medtronic, and people and teams of people who are working on diabetes products and technology are to patients, because I feel like sometimes patients feel a little bit alienated, or you guys don't know what we're going through. But it's been just really refreshing to hear that. So how are you guys continuing to push forward?
Well, we can't do it alone, which again is why organizations like the ADA bringing us all together is so important. Specifically for Medtronic, though, we do the best that we can, and listening and then being able to provide products and solutions. I think what's exciting now with exactly even what you do, it gives us a whole nother avenue to be able to listen. So what I would say is we do want to listen. We're committed to change. We might not get it right exactly the first time, but we want to continue to improve. So keep doing what you're doing. You know, we are really interested in the blog posts and the feedback, and that's so incredibly important to us. So thank you for what you do, and everybody out there. Keep being vocal. Keep telling us what you like and what you don't like, and know we're on this journey together.
Well, thank you, Laura. I really appreciate you taking the time with us today. I know this is a hustle and bustle event, and we are all running in a million different directions. But I appreciate you sitting down with us. I know everyone's going to appreciate your comments as well and hearing from you. So thank you. Yeah, we're going to move on to our next guest, and it was great to meet you. And we'll hear from you and your team soon.
All right. Well, thank you, Rob, and thank you, everybody out there. And remember, check out Guardian Connect with Sugar.IQ. We want to hear what you think.
Great. So just to remind you, we are live from the 78th Annual Scientific Sessions here in Orlando, Florida. I'm Rob Howe reporting for Medtronic Diabetes. This is a live stream video, and we're going to be interviewing a few more people throughout. So if you have questions, please send those in, and we'll get back to you with responses sooner than later. So Hiten Chawla is my next guest. You're Medtronic's Vice President of Marketing for the very popular advanced insulin management business. So we're going to talk a lot about my own journey on some of the advanced insulin management products today, but why don't you give a little bit of background on the Medtronic 670G hybrid closed-loop system, because we talked a lot about it this weekend, but for those of us who may not be as familiar on the live stream, just give us the breakdown of that amazing breakthrough product that we actually debuted last year at this event.
Yeah, well, thank you, and nice to meet you, Robin. Hi, everybody. So, yeah, you asked me about the 670. I'll share a couple of my thoughts, and since you're a patient as well, I'd love for you to share with all of us as well. But as you know, 670, the MiniMed 670G system is the only automated insulin delivery system that automates basal insulin to provide more time in range. And that's really a technological revolution that happened through years of experience, and providing better outcomes is critical to that. And so if I have to think about what this technology does, honestly, is providing better control, better peace of mind, through years and years of research, and that's what the MiniMed 670G is. But before I actually go ahead and then talk about where some of the great data that we're seeing that's coming out, I'd love to ask you, in fact.
Oh, you're going to put me on the spot.
Yeah,
here.
I am,
Okay,
I
great.
know. So, what do you think? What is 670, MiniMed 670G for you?
So I think for me, and fellow ambassador Addie Finch and I have been having patient discussions here in the Medtronic booth this weekend. For me, I like to start where, when I started on 670, I had good control. My A1Cs are within range, and I'm happy with my control. So for me, it was taking a step out of my comfort zone and saying, I really do want to pursue better technology that's going to give me better confidence. Mm-hmm. My actual outcomes, and sometimes as patients, it's hard to understand the word outcomes and what that means for us. Yeah. But I'll give you an example. I'm a creature of habit, and when I go to the grocery store, I always used to buy 2 half-gallons of orange juice from Trader Joe's. I'd pull them off I walk right up to it. It was like the second step when I get in the grocery store, easy, and that was how I treat my low blood sugars. Oh. So. Since starting on 670, I don't buy those 2 jugs every week anymore because I stocked up on orange juice too much, and I actually had some expire. So because my lows have been limited, that's my experience. And, I think the biggest part of keeping that consistent line throughout the day. So now I know when I get my A1C results, I know where I am in range. I know it's not just an average of big lows and big highs and meeting somewhere in the middle. I know I have a little bit more confidence in my control throughout the day. Right.
So, thank you for sharing that story, because, with the MiniMed 670G now out for about a year, this year, it's all about looking at some of that real outcomes and data. And when you said outcomes, and I said outcomes, well, here's a couple of things that are critical that we're hearing at the ADA conference this time. And it's all about quality of life. We hear about less hypoglycemia, less hyperglycemia, but what does that actually mean in terms of quality of life? Are you just sleeping better? Are you getting up better? Are you thinking less about diabetes? And for me, that's actually really exciting.
sleeping through the night more often, and not scratching a workout at the gym. Those things have profound impact in micro moments that they're really having that impact.
Yeah. I'll tell you a little bit about the market research in me, right?
I love
it. It's something that I kind of talk about. It's very important to kind of share feedback. Laura shared that with you. One of the things we do at Medtronic is collect feedback, right? We have a tremendous number of patients now, 100,000 patients who are at least been shipped the MiniMed 670G, and we conducted a survey and trying to find out what has the experience really been around quality of life. And the geek in me will tell you there's 39 different parameters that are actually used to define how quality of life is, whether it's like we were talking about sleep.
Just 39?
Yeah, just 39. So, and it's amazing to see that amongst those 2,500 patients, every one of them, and I mean every single one of our patients said that there's a statistically significantly improved quality of life across those parameters. And it's fantastic to hear that. Very inspiring.
It is, and I think when you look at the data, it becomes clear the impact that those things are having. The announcement now is like you mentioned there's 100,000 people that have currently been shipped 670G. This week we got important news that number could be growing dramatically for a certain part of our patient population. Why don't you talk a little bit about that?
Sure. So again, inspiring and exciting both. So very recently we announced some strong data that's actually coming out here at ADA with the pediatric indication. So for patients from 7 to 13 years of age with the MiniMed 670G. And we also got FDA approval a couple of days ago for this revolutionary system with the indication to go in this population. And it's really, really powerful. But for me as a parent, one thing I can tell you that I'm always worried about what's going on with my kids, what they're doing, what's going on. And so to really have the data to actually show that the MiniMed 670G can help children live better lives, and importantly, parents like me, just be less worried or no less worried than anyone else about getting those outcomes. This is so good. I'm genuinely very excited about that because as a parent, I can't tell you how important that is.
Well, and you bring up a great point. Diabetes doesn't just affect the person who's diagnosed. It doesn't just affect the patient. And to give quality of life back to the people around them as well is also important in that confidence.
I wasn't an easy kid, I'll tell you that. So I know growing up is hard anyway.
Right.
And so.
Yeah, it's great. Talking about automated insulin delivery and like the future of pump therapy and diabetes treatment, it's a hot topic here at the conference, and it will continue to be for the foreseeable future, I'm sure. What can patients expect to see from your team at Medtronic sort of in the near future? What are you guys working on?
Sure. Automation is, like you said, it's really important. And Dr. Francine Kaufman, who's our chief medical officer, and I've had the fortune of working with her for the last 10 years here at Diabetes, has a quote that she says, and it kind of strikes home in a lot of ways. Over the last 10, 15 years, we've come a really long way in terms of the technologies, in terms of the insulin that's out there, to get better outcomes, better quality of life. But it's kind of like when you're climbing a mountain, you've reached to the top, but the journey isn't over. And in fact, coming down sometimes is just as hard as climbing up. And so I think that we're at that point where with the MiniMed 670G, we've gotten to a point where we are getting phenomenal outcomes. But it comes to a point where do we go next, right? So it really comes down to feedback, really, from you, from our patients, from our healthcare providers. And it comes down to a couple of key things that I'd like to mention here, things that we've heard. One is just how do we make our devices simpler? And so while the technology is revolutionary, provides more time away from thinking of diabetes, what is the kind of work that I have to put in? So that's definitely number one. Number two is actually getting our devices to be more discreet and easier to use. Number three is connectivity. With the MiniMed 670G, one of the really important things that I'm excited about and inspired about is getting more connectivity into it, getting information onto the cloud, and getting access to parents as well through some of those things. And last but not least, the software and just how you interact with the device and getting it to be even more intuitive than it is. So.
It's great, and I think as patients, we often don't get to see the thought journey and the experimentation, and how you guys are continuing to push and climb the mountain, as you say, and then continue to climb. As you think about Inspired by You and the things that you've been inspired by, people living with diabetes, as things that you hear here at the conference, any final thoughts that you have, for people living with diabetes watching this live stream?
So that's your hardest question, honestly. One final thought, and have to stick to one.
I couldn't let you get out of this hot seat without at least one tough question.
Okay,
right?
well, yeah, there you go. So for me, I think my final thought I'll use two, okay?
Perfect, I'll allow it.
Thank you. Well, first is actually thank you, and thank you. That's my final thought, part one. Because it really wouldn't happen without our partnership. And just to be able to hear feedback and talk to people with diabetes and physicians that manage them is so inspiring. And the second part, and why I kind of got to the second point and how it's related, is meetings at like the ADA. And that's why I wish all of you were with us more than just through the camera. But hopefully this is creating a medium, because just to see the energy and to be able to say, how do clinicians partner together? How do we actually partner in clinical research, in fact? And many of you have participated in that with us. And so thank you for that. And then last, as part of that, thank you is keeping this feedback coming. Laura ended with that. I want to say it the same. It really wouldn't happen, and improvements wouldn't happen if we didn't get the feedback. So that's my plug, to continue to kind of go online, give us feedback, and we'll promise to continue to be in touch and make things better.
Well, Hiten, thank you so much for your time. It was great to chat with you. And yeah, we're going to continue to keep the feedback going. If you guys have comments, please send them in.
Thanks.
And we will address them. Thanks to you again.
Thank you.
We're keeping the conversation going. I'm going to introduce my next guest here, David Edelman, who is a co-founder of Diabetes Daily. And David, I'm excited to talk to you because you are not a healthcare provider. You're not Medtronic leadership. Just you and I are just going to be two people who are attending this conference, and we get to kind of be on the outside looking in.
Yeah, it's pretty awesome to be here, and glad to see you.
Yeah, welcome. Welcome to the show. Again, we're broadcasting live from the 78th Annual Scientific Sessions in Orlando, Florida, and I'm your host, Rob Howe. So, David, let's talk about this conference, because I still feel like we haven't really done it justice in terms of the scale of how large this meeting is, and how important it is, as Hiten mentioned, that the stakeholders here are having the discussions that they're having. So you've been to, I think, 10 ADAs, if I'm not mistaken.
My 10th ADA.
So across those 10, what makes this one different?
I feel like this is really the coming of age of where we see data and intelligence actually come to life. And it's kind of this future we always imagine. What's it like when computers and machine learning and AI can start to help and look at these complicated experiences of managing your own, you're trying to manage your own pancreas on your own, and it's complicated, hard, and there's a million factors to consider. And to have computer technology that can help us do that it's amazing.
Yeah, and I think it's also, from my perspective as a kind of techno nerd, and looking around on this conference floor and going into these booths and hearing these presentations about how excited people are about the future of diabetes. And I think as somebody living with type 1, as a patient, it's easy to get discouraged sometimes, because, we go day to day treating the illness. And I know as a member of the Diabetes Online community, you see some of those commentary as well. What would you tell somebody about what's happening here and what you're hearing here on the floor? What's the next step, and what's to be excited about besides the data and intelligence, which I am super pumped about, like uploading to the cloud? I want to have all that insight immediately. What are you seeing that gets you excited?
Well, can we go back briefly for 1 second?
Of course. We can do whatever we want. We're live.
Awesome. In 1999, there were no CGMs. There were no long-acting insulin. Insulin pump technology was in its infancy, and I think sometimes to appreciate that it's 20 years, but I think the pace of change is just rapidly going, and there's a lot more medications on the horizon. There's faster acting insulins. There's far better devices. There's integration between devices and sensors. There's implanted sensors. There's implanted drug delivery devices coming. And to live in this world where all of a sudden these things are finally converging. And I think you mentioned the feeling of like excitement here. I think it's because it's finally happening.
Right.
For years it was like you listen to these presentations and it's coming up in a few years, and a few years, and a few years, and finally it is a few years where we've kind of arrived in an exciting age of genuine progress.
You know, it's interesting because I think everybody who's been diagnosed with diabetes has had a conversation where in 10 years, in 20 years, in 50 years, if you go back that far, we expect that this will be available. And you're right.
Yeah.
Like every booth I turn around here, there's something new that I've heard about in the media or I've heard about just in people talking, just word of mouth. Those are coming to life. They're being released it all starts here at this conference where they're announced and sort of unveiled.
Yeah.
Is that, you think, the biggest difference between this ADA and ones in the years past?
Yeah, and I'd love to give a shout out and props to the FDA, who have done this incredible job of creating a roadmap that companies are able to follow, because the pace of product updates has been phenomenal compared to what it was. And it's like what a difference it is to go from the 630 to the 670 and beyond. And these are, what, a 1-year time frame?
They are, and I think this week was a big week for the FDA, and I think they're starting to. This is only my opinion, but I think they're starting to realize like how many things are right on the cusp, and how important they are for patients, and it's just exciting. And I think, for me, I'm trying to articulate I think the best way, and I'll do, because you're a diabetes journalist, you understand how to talk to these people. How would you tell somebody about this? Because I'm having a tough time. Like the scale, it's so large. There's so many cool things happening. For somebody who's not here, a patient who's not here, how would you describe this place?
First of all, it's massive. It's the largest scientific gathering. I don't know, 17,000, 18. What's the attendance?
Something. I had over 15,000. I'm gonna keep it at that.
Over 15,000 people here, and I think what excites you, what excites me, and what people might not feel is, this is a totally unique environment. The diabetes community connects people who are so passionate. And there are people living with diabetes in all of these companies. And there's a lot of camaraderie between people here. I think sometimes, pharma devices, they can seem like this, they don't understand the needs of people, but there are so many passionate people here who really want to make a difference. And I think for everyone here, it's just so energizing to hear the passion and enthusiasm for making life better.
It is exciting, and I think it's contagious, really, and that's why I like, running into the energy here is sort of palpable, and it's all for making life better with type 1 and type 2 diabetes, which is something that resonates really heavily with me, and I'm sure with you, and getting to be a part of that here, like boots on the ground, is just really exciting.
It's just tremendous.
All right, so what are you excited about? What's the future between now and the next ADA? What's big on your list?
Between now and the next ADA, I think it's on the technology side, improving sensors, better communication. Actually, what I think is really exciting is with all this sensor data and all this information, and like Basal IQ is kind of a first step towards there, the ability to pull all the data automatically, data about physical activity, data about insulin usage, data about foods you consume, and even like pulling in from electronic health records in clinics, all the medication and experiences that everyone's having, being able to crunch that and really have a full picture of the diabetes experience, because we've had a lot of hunches about what the diabetes experience is, and it turns out a lot of them have been wrong. And I think we're really shining a light on the diabetes experience now in a way that it's never been able to be possible to do.
And I think, to your earlier point, now we're starting to see all these things that we knew were coming, and we're getting data from them, and we're able to, I think, propel us forward to whatever the next horizon might be.
I'm genuinely optimistic about the future, and it's nice to be able to say that, because that wasn't always the case. We felt like we were kind of stuck for a while, and I feel like we've unstuck.
Yeah, well, I mean, that's inspiring, right? To authentically say that you're excited about the future of life with diabetes. I am as well. So, David, thank you, man, for your time. I appreciate you coming here. It's great to meet you. Thank you guys all for joining in on our live stream, live from the conference floor here in Orlando at the 78th Annual Scientific Sessions. I'm your host, Rob Howe from Diabetics Doing Things. Thanks, and check back in next time. We're also going to get to your comments, so just go ahead and keep leaving those, and we'll respond. Thanks, guys.
Take care.